All right, our last lecture, musculoskeletal disorders. All right, so there's all kinds of fractures. You have like your complete fractures, so these are breaking through the skin. These need to be like bars, screws, all the fun stuff set in. This is a incomplete fracture here, so or non-compound fracture. This one can be set with a cast typically, and then up here you have green stick fracture. These are usually in children because they have lots of collagen and less calcium deposited. So the bones are not as brittle. They have more flexibility in them, and usually doesn't take much to fracture. That's why it's so common in children. Plus, as kids, we do dumb things. Right? And then bone cyst right here. So in this situation, I've heard stories where like a kid goes to throw a ball and they just break their arm. Right? Jumped. Okay. Stress fractures. You typically see these with like tumblers, gymnastics, stuff like that, karate. And I even know someone that got it from walking in flats. She would walk around our building and log like 20,000 steps a day, that kind of thing. And from doing it in flats all day, she actually created stress fractures in her feet. Had to wear a boot. So as far as bone healing goes, there is like initially a gap and then post-surgery, and we can see it restructuring itself. And, you know, something to keep in mind here that people don't think about is like, let's say you're 40 years old. This bone matrix, you know, above the break, below the break, is 40 years old. It is strengthened over time by replacing the matrix and all that. Whereas where the break is new. And so refracturing this area is very common. It doesn't take much. And to put it in perspective, one time I broke a bone in my foot. It healed. I remember I was in the grocery store and I was like pivoted to turn around to look for something, and I heard it recracked. It was wonderful. Hey, don't be like me. So bone healing, you know, a couple weeks, we heal, we create, you know, this new hard callus. It's still weak, can still break, and even beyond, it can still break. They initially can have like hematomas in here, so swelling, inflammation, that causes a lot of pain. So that's why anti-inflammatory drugs are important. Dislocations. Once you dislocate, you are at continued risk of dislocation. You have stretched ligaments, tendons, that's it. The acromioclavicular joint here, the problem here is, so that's your normal, that's dislocated. There's nothing around the base here. And so it's very easy for it to slip anterior and inferiorly. Very, very common. Right? So really there's nothing you can do but follow RICE, rest, ice, compression, elevation. So they put them in a sling, we pop it back into place, and you just rest it, ice it. Okay? If it's really, really bad, they've torn, you know, ligaments, tendons, then they end up with surgical correction, but not much to do there. Same thing with the hip. So that's very common. The problem is they tend to damage it. They can develop what's called avascular hip necrosis. So this is destroyed right here. And so we end up doing a hip replacement. So this is what they saw with, you know, I've fallen and broken my hip. That's what's happening. Okay? And the reason you end up with avascular necrosis is the way the blood supply is. So if they get a fracture up here in the head, this will die off. And that's what's happening here. It's starting to die off. You can tell. And, steroids weaken bones. So anyone that's on corticosteroids for any reason, a Crohn's patient, for example, arthritis patients, rheumatoid arthritis, stuff like that, they are at increased risk. Sprains. So sprains, you know, you're typically not hurting too much. Okay, so the ligaments will stretch but are not torn. That's typically how it is. If tears happen, you may end up needing surgery. It's extremely painful. And once again, with sprains, they take a long time to heal. Sometimes they never ever heal, like the ACLs. Okay, so if they tear, they need to be surgically corrected. All right. So spraying here, they're showing, you look at this joint space, they can measure like tib-fib clearance, and they can see if that is considered normal or not. This would be in severe, like rolled ankle situation. Right? More concerned about, I guess, a break there, a full tear, and so that's why we bring in the imaging. Tendonitis, there's all kinds of different tendonitis. So really the tendons are being agitated. Typically there's like what's called like a snuff box, for example. So this is Quervians. And it gets agitated, it causes swelling, and that can actually constrict nerves, so they can get numbness, and then it starts to thicken up in that area. It hurts, there's swelling, there's not much you can do other than inflammation or surgical correction, and lack of use, or don't use it as much. That's what I mean. Bursitis, so you have these little bursts all over your body, approximately 150, and they're basically sacs of synovial fluid, and they help cushion so things don't ride on each other, that kind of thing. They can become infected. So that's a real nasty bursitis. So I'm pretty sure that's someone's knee. I think. I can't tell. It's nasty. Or it's the back of an elbow. Maybe it's the back of an elbow. Yeah, it's the back of an elbow, because he's sitting right there. So severe inflammation here. So if it's infection, you treat it with antibiotics. Gout. So these can be called tophi and gout. And so I've seen these like over someone's wrist here, and it was like that big. There's nothing you can do but prevent gout episodes, so that you can prevent that. And then sometimes with trauma, they'll suddenly just start generating more fluid, and they can be drained, or just not use the joint for a while, and that can help reduce it. Compartment syndrome. So you can see this after trauma. You can see it post-surgery. So what happens is there's so much swelling, it starts to occlude the blood supply and choke off the tissue, and can damage nerves, and the tissue itself can die. So sometimes what they do is called a fasciotomy, and they leave it open until the swelling reduces, and then they close it up. Right? Like you can see how swollen his leg is versus the other one. Rhabdomyolysis, so typically you talk about this with crush injuries. The myoglobin is released from the skeletal muscle and clogs up your kidneys, and you go into kidney failure. Certain medications can do it as well, so statins, seizures, like really long seizures, burns, right? And dermatomyositis, which is an autoimmune disorder. Osteopenia, so this is thinning of the bone, okay? The density is decreased, and then full-blown is osteoporosis. So they're showing in the x-ray here where the markings are. These are compression fractures of the spine. Bone density decreases, so they can do bone scans, figure out your bone density. My father-in-law, for example, he has rheumatoid, and he used to take prednisone all the time for flare-ups. I don't know why his doctor dragged it out before putting him on Humira. Well, because of that, he used to like jogging, and just from jogging, he developed this back pain, or later we found out it was from the jogging. So he goes to get checked out for this back pain, and sure enough, he has compression fractures in his spine from jogging. Okay, that's how much demineralization of the bone there is when you take steroids. So avoid steroids, people. Osteoporosis, so as it goes on, it's just thinning of the bone. So eventually fractures are easier to happen. Really, the biggest defining factor of whether you're going to have osteoporosis or not is genetics. If you have parents that have it, there's a high probability that you will. You can take all the calcium you want, not going to make a big difference. Okay? The biggest difference in bone density is strength training, weightlifting. The weight, when you do that, the bone is stressed. When the bone is stressed, it causes cell turnover of the bone, or matrix of the bone turnover, and strengthens the bone over time. So lift weights, people. Osteomalacia, rickets. Osteomalacia is in children. It'll appear like osteoporosis, but it's due typically to a lack of calcium or calcium absorption. So something's wrong with the GI tract. They're not getting vitamin D. something along those lines. And then rickets is in children, typically vitamin D deficiency. It's a diet-associated one, so they're showing like the bowing of the legs, thinning of the bone here. There should be bone right here. Okay? And then osteoporosis, just break down faster than it's made. Paget's disease, this is a neat one. This is a overactivity. Basically, it's initially osteoclast, then it's osteoblast, then it's just osteoblast. And so they deposit bone, so the widening of the diploid, the space here in this flat bone, and you can see all the skull deformities. Osteomyelitis, this is bone infections. Okay? Typically, you talk about IV drug users. That's where you're going to see a lot of it. They reuse needles. They don't clean the skin. Okay? So very, very easy for them to get infections. And then it can also be in the sole of your foot is another common area. And the reason being is you step on like a rusty nail, something that punctures it. The bottom of your shoe likes to carry Pseudomonas aeruginosa, one nasty bugger. And that will puncture through, and they tend to get infections in their foot. Osteoarthritis, so osteoarthritis versus rheumatoid. Osteoarthritis is from overuse, and you get bone spurs, it hurts. So, and then rheumatoid is autoimmune, and they carry crystals in the joint space, and it damages the joint space. Here's how you can identify easily which they have. In the morning, if they feel good, they have arthritis, osteoarthritis, just normal arthritis. As they use it through the day, it hurts, it inflames, bothers them. Rheumatoid, they wake up in pain. They'll have random flare-ups in the middle of the night. Non-use doesn't help. Actually using it helps get rid of the pain for rheumatoid. So osteoarthritis, rest gets rid of it. Rheumatoid, use gets rid of the pain. So the problem with this too is like people take, aspirin all day or Tylenol all day, and so you get this secondary effect on the kidney, the liver, that kind of thing. They get gastritis because they're taking NSAIDs on empty stomach. So with either, rheumatoid or osteoarthritis, that's like the secondary issue you've got to deal with. Spinal stenosis, so here the pathway for the nerves is becoming stenotic or closed off. So nowadays they actually do like a little laser therapy. They do a little tiny incision on the back. They go in there with a laser, they zap it, they shrink it. You're going home the same day. So it's become very, very good. So they can have all type of issues, pain, weakness in limbs, weakness or numbness. Okay? So all kinds of different issues. And like it doesn't have to just be like in the canal itself. It could be like injuries like herniated discs, tumors, any of that. So here, like here's a herniated disc. That's what the pinched nerve comes from. So relieving weight is the best thing you can do for these patients with a herniated disc. So weight loss, they can do like inversion tables, that can help. But weight loss is probably the best thing they can do. And then surgery is the final option. Arthritis, so typically like it's, all kinds of things here that we're looking at, rheumatoid mainly. So it could be just damage from use or rheumatoid, which is autoimmune. They get what are called like swan fingers. You can see how the fingers are bending. Every time there's a flare-up, there's permanent damage. So it is important to prevent flare-ups. That's where drugs like Humira come into play. These monoclonal antibodies just prevent this from happening to begin with. So you're stopping the disease progression. That's what's really, really important. Okay? And then gout, another autoimmune. There's that toe phi I was talking about. So it typically affects the big toe. That's the main place. Uric acid buildup is what's triggering it. So they need to avoid things that are high in purines. So that's your adenine and guanine, if you remember. So a lot of your beer, your red meats, all the good stuff. Those are big triggers. Okay. Ankylosing spondylitis, I've seen 2 cases of this. Typically starts in the 20s. They develop what's called bamboo spine. It fuses. All their joints start to fuse, SI joints, so they tend to waddle a bit, and over time more and more fusion. Linked with this marker HLA-B27, which is also a marker for type 2 diabetes. But yeah, I've had a couple students that have it, and they were in different states in their disease progression. Lupus, systemic lupus erythematosus, or SLE, all kinds of symptoms. The mallet rash here is a big telltale. They can have Raynaud's phenomena that you see in the fingers here. Typically, Caucasian female in her 20s is about where you see it pop up, but it can be any age, and then just all kinds of issues that they can have. Lyme disease, something to be mindful of. This is the bullseye rash. It does not appear in all cases. I think it's like 75% of people will show the bullseye. So, tick bite, Ixodes tick. We have it here in Georgia. It's everywhere. It's really up in the Northeast. Lyme, Connecticut is where it was discovered, hence the name. But it causes all kinds of issues. Everyone is different. They can have migratory arthritis, pain. They can have heart issues like a carditis, and then it triggers your immune system to attack your body randomly for the rest of your life. So what symptoms you get can be different. It's easy to treat. You got to take like doxycycline for, I believe, 30 days. Okay, so if you get a tick bite, go see your provider. Take the tick with you. It's just easier to take an antibiotic than risk damage. I've seen quite a few cases. I actually had one summer I was teaching micro, and one of my students comes in, and we had learned about Lyme disease, and he lived up and coming, and he's like, I gotta show you something, and he pulls his arm up like this, and he had the big old bullseye rash right there, and he was telling me, he's like, I think one of my dogs just brought a tick in, and it got on me and bit me. So be mindful. And then chondrosarcoma, so this one's pretty rough. This malignancy, they sometimes refer to it as starburst imaging. It destroys the bone. You typically have to amputate, unfortunately.